Thank you, Gabriel, and thanks, folks, for joining today in this unusual time for us. Maybe some of us will get Friday afternoon off if things go well. I'm going to talk a little bit about where we're at very briefly with our outbreak because things are changing, and then speak a little about the news today from the ACIP around adolescent vaccination. So with respect to our outbreak, our most recent data suggests we are slowly turning the corner on the recent surge. We've had a decrease in the 7-day average for cases of approximately 20%, from around 350 a day in late April to 280 or 290 a day over the last week. We've also seen a 27% decrease in hospitalizations compared to the prior week, with 98 people hospitalized or one person every hour and 42 minutes last week. And then another great piece of news is that yesterday we passed a threshold of 70% of King County residents 16 years and older with one or more doses of COVID-19 vaccine, and 52% of King County residents fully vaccinated. This is phenomenal. This is largely due to high vaccination rates among older adults who are realizing the protection with decreased hospitalizations and deaths. And we have increasing numbers of younger adults being vaccinated, and now we'll have adolescents as well. And we need to extend this protection to more younger adults and adolescents so that our whole community can be protected and we can all do more with others as safely as possible, as soon as possible. And with respect to the vaccine news, COVID-19 has caused tremendous disruption to the lives of all Americans, including children, and some would say particularly children. Adolescents and younger children are making up a growing share of new COVID-19 cases in the US, accounting for about 20% recently. 9% of recent cases are just due to adolescents in the ages of 12 to 17. And although rates of hospitalization and death are relatively low, some adolescents do develop severe illness. There have been over 1.5 million reported cases among adolescents 12 to 17 years of age and over 13,000 hospitalizations to date during the COVID-19 pandemic. And the hospitalization rate for adolescents in that age range, 12 to 17 years, although much lower than for adults, is about twice what we saw during the 2009 pandemic H1N1 influenza outbreak and about 3 times higher than in recent flu seasons. Among adolescents 12 to 17 years, there have been 127 COVID-19 deaths through the end of April. And that translates into about 1.3% of all deaths being among adolescents. And then there's also the issue of the multi-system inflammatory syndrome in children. This is that rare inflammation that occurs 2 to 6 weeks after SARS-CoV-2 infection and can result in a wide range of manifestations. Frequently, the heart is involved and patients need ICU care. Through May the 3rd, there have been 804 cases in adolescents reported, in adolescents 12 to 17 years of age reported in the US. And finally, as we all know, children can not only acquire COVID-19, but they can spread it. They can spread it to their friends and others who are at low risk, but they can also spread it to susceptible high-risk children and to susceptible high-risk adults who do get more severe disease. So for these reasons, today the Advisory Committee on Immunization Practices recommended the Pfizer BioNTech COVID-19 vaccine for persons 12 to 15 years of age in the US population under the FDA's emergency use authorization. And in addition, the American Academy of Pediatrics endorsed that recommendation for all children and adolescents 12 years of age and older to be vaccinated. So this is great news. Now we have teens who are eligible for the Pfizer vaccine, and this will allow more teens, young people, to gather safely with their friends, their families, return to sporting activities and others that are not only critical for their mental health, well-being, and development, but that we know they want to do so very badly and they want to stay healthy while they do it. So with ample vaccine supply now, we've got many vaccine providers across the county ready to serve these young people. You can go ahead and call and check the usual sites, and there are consent policies where some providers will require a parent and guardian to be present, but many will only require written permission, and there are exemptions for youth who are emancipated. Parents can bring their children who are 12 and up to our high volume sites. There are no appointments needed at many of our sites across the county. And for information about our walk-up sites and ADA accessibility, interpretation, or ride services, you can check kingcounty.gov/vaccine. Many community health centers and many pediatricians are also offering vaccine, and kids will be able to access vaccine at their school quite frequently as well. We've reached out to all the school districts in the county and matched them up with vaccine providers to enable vaccine clinics on campus before school lets out for the summer. And starting next week, we know that nearly all districts have plans in place to hold clinics at high schools and middle schools. So your school district will have the information and details on the plan for vaccination of students in that district. Our high volume vaccination sites in Kent and Auburn and Lumen Field in Seattle will be hosting family days this weekend, which is a great idea for all ages who are eligible, 12 and older. And we will continue to help motivate people who are on the fence and just need a little nudge to get vaccinated. We're partnering with For Culture on a pilot program called Vax to the Future, which will bring art and music to COVID vaccination sites throughout the county. And this will make vaccination a community-focused event that will encourage people to get vaccinated and share their vaccination experience with others using social networks. This will be a strategy that we hope will motivate some young people. And the first events start this weekend with live music outside the Kent Showware vaccination site on Saturday from 11 to 3. We'll have special buttons that were created by the local artists for people who get vaccinated. Walk-ins are welcome, or you can register in advance at kingcounty.gov/COVID/registration. And I just want to finally finish up with a note about Vsafe, which is a smartphone app for parents and anyone who is vaccinated to track any side effects or adverse effects that you may or may not experience. And we'd really love everyone who's vaccinated to use this app. There should be instructions available at all vaccination sites. It's a great thing to do while you're waiting that 15 minutes after you're vaccinated during your observation period. Parents and guardians can enroll adolescents and complete health surveys that come by the phone. It takes 30 seconds to just answer a few questions about how you're feeling after your vaccination. Parents can complete the survey on behalf of the adolescents. Adults can complete the survey themselves and describe anything that you may be experiencing. And this is even important for the vast majority of people who feel well and have mild or no side effects after vaccination, because we really want to understand the full range of people's experiences. And this is one of the ways that CDC is continuing to monitor vaccine safety as they get expanded into more and more populations. So with that, I'll pause and welcome any questions about the course of our outbreak, where we're headed, or today's news about adolescent vaccination.
Thanks so much, Dr. Duchin. And just a reminder, please use the raise your hand function in Zoom to let us know you've got a question, and we will try and get as many folks in as we can. To kick us off, as traditional, Jessamine McIntyre, please go right ahead.
Thank you, Gabriel. Thank you, Dr. Duchin, for your time earlier this week. I just got my second shot today, so I'd like to thank you for all of the information you've provided throughout the months. Was wondering, though, with the EUA, with the CDC's announcement for 12 to 15 earlier, we have reporters who spoke to a 12-year-old who is getting vaccinated at Lumen Field. Did the city have authorization to immediately start shots, and how exactly would that authorization go?
Mm-hmm. Yeah, great question. Congratulations on being vaccinated. I'm very happy for you and for everyone you come in contact with. Glad to hear that. And I hope you're using Vsafe. If not, download it. It's very fun. The authorization, it changed a little bit. So initially with the COVID-19 vaccination program, the provider agreement, the federal provider agreement for vaccine providers are required that they adhere to the ACIP guidance in administering vaccinations. And so there was always a bit of a lag between the time the FDA approved the vaccine, the ACIP made their recommendations, and those are formalized on the CDC website before providers were permitted to start using the vaccine. However, in late April, CDC modified the provider agreement that authorized providers to use the vaccine anytime it's FDA authorized. So if they're using the vaccine in accordance with the FDA guidance, using the FDA information sheets, anytime a vaccine is approved or authorized in this case for use, providers are allowed to use it. We suggested to our providers to wait for the CDC guidance because sometimes things come up that are not known in advance about how the ACIP would like this vaccine used, but there were no surprises. There's nothing new. There are no special precautions or indications beyond which are described in the FDA authorization. So providers are free to use this vaccine and have been since it was authorized by the FDA. And there will be further guidance on the ACIP website. They call clinical considerations to FAQ for healthcare providers who would like more details, but it is permissible to use the vaccine once authorized by FDA.
Thanks a lot. Our next question is from Steve McCarran. Steve, please go ahead.
Thanks very much. The state said today that it is already seeing a positive impact from vaccinations, including a slower transmission rate and then fewer strains being put on the healthcare system overall. And I was wondering, based on some of these stats that you mentioned at the beginning of your remarks, does that show you that the vaccines are working here, particularly in King County? And what's the new goal? What percentage of the population do you want to see vaccinated in order to reach the level of immunity that we think we need to hit? And when do you expect us to hit it?
Yeah, well, those are really good questions, and they're a little bit complicated. Clearly, these vaccines work. I mean, every clinical trial and all the post-trial data, the real-world vaccine effectiveness studies are showing that the vaccines are as effective in the real world as they were in the clinical trials. 90+% for the mRNA vaccine, 75% for the J&J vaccine against all infection, and higher for serious infections leading to hospitalization, and higher for death. So the vaccines, we know they work, and we know they work well. So the more people that are vaccinated, the more are protected. And we've seen that most dramatically in the fall off in the number of deaths, hospitalizations, and cases in the older people who were vaccinated first and have the highest vaccination coverage. And we expect that as more middle-aged and younger adults become vaccinated, we'll see something similar. And that's maybe behind the falling cases that we're seeing. It's probably playing a significant role in the falling case counts that we're seeing now. However, the level of disease activity is dependent on a number of different factors. Vaccines are critically important, and the more vaccines that are used, the more people that get vaccinated, the less disease we'll see. But also, it's critically important because this virus is still out there, it's still circulating, that our behaviors, also play a role. And so people's limiting their activities, staying away from others, particularly unvaccinated people in crowded situations, indoors, wearing masks, all these things contribute to falling transmission rates. And then there are things we don't understand that some call seasonality, that in the spring and summer in certain locations, cases seem to drop. And it's not exactly clear why that is. It may have something to do with temperature and humidity. It may have to do with increasing ventilation when people open doors and windows. That's another critical thing that we can do that will help stop the spread of COVID-19. So I think, there are multiple factors that are involved in the falling case counts, but I think the one that's most important and the one that we're going to depend on as a community and as individuals over time for the long haul is vaccination coverage. Because this disease won't be eliminated, we'll still need to be aware of the risk of getting COVID-19 when you're gathering with unvaccinated people, particularly if there's significant amount, virus still circulating. And here in our county and in our state, it's great that the outbreak, the increasing number of cases seems to have turned around, but we're still at a relatively high level. More cases and more hospitalizations, for example, than we saw last summer, more cases and hospitalizations than we saw before this fourth surge started. So we have a ways to go before we're really at a level of, what we call low level of COVID transmission, where we can truly feel, less worried about acquiring the disease if you're vulnerable, if you can't be vaccinated, or if you are a high-risk person who just wants to take every precaution possible. There is no, magic way to predict this. The only way to know for sure what level of vaccination coverage is necessary to prevent significant, optimally COVID transmission in the community will be in retrospect. We can't predict this right now because of all these other factors. So, for example, in a community that continues to observe precautions and is careful about ventilation, maximizing ventilation, and decreasing the risk in indoor air spaces, there's less risk for transmission, and lower vaccine coverage will produce the same level of benefit. If you have more risk, if you have a higher rates of disease in your community, if you have more gatherings of people who are unvaccinated, if you don't pay attention to ventilation, your risk is higher, and you'll need a proportionally higher rate of vaccination coverage to limit transmission. So the amount of vaccine coverage that's needed really depends to some degree on the types of things people are doing and the other safety precautions that they're adhering to. I imagine that we've got 70% in King County, 54% in King County now, a tremendous success with our vaccination coverage so far. We know that many cases are in younger people. As we get more younger people and continue to get young adults vaccinated, I think we're going to see continual decrease in the number of cases. So I can't give you an exact number. I would say that if we hit 50% of the total population vaccinated, and that was fairly equitably distributed, because again, you can have high coverage in some age groups, older adults, for example, and still have lots of vaccination happening. Lots of transmission happening in under-vaccinated younger adults and children. That's not a great situation. So we want to make sure we've got adequate levels of vaccination coverage across the age spectrum who are eligible for vaccine that will maximally suppress the amount of transmission. So it's really a matter of time. There's so much about COVID-19 that we can only learn in retrospect. We know vaccines work, but exactly how much coverage we're going to need to achieve a certain amount of benefit we'll only be able to tell once we get there. That was a really long answer.
Thanks a lot. Our next question comes from Carolyn Bick. Carolyn, please go ahead.
Awesome. Thank you so much. I wanted to ask, circling back around to the issue of young adults and adolescents needing potentially permission from their parents or guardians to get vaccinated. What options do unhoused youth who don't have a parent or guardian and who aren't legally emancipated have to get vaccinated? Or even for youths and young adults who live in unsafe home situations, like a domestic violence situation, what options do they have?
Yeah, if a young person is eligible for vaccination and wants to be vaccinated and is basically emancipated for all practical purposes from guardians or parents, there are criteria that vaccinators can use to assess that's the situation of that particular homeless youth or youth who is without parents or guardians, and legally be able to vaccinate them. Of course, we prefer to have, when possible, parent present or parent permission, written permission, but we understand that there are some youth who do not have that option. And so we do not want to systematically deny them the ability to be protected against this disease. So we will apply the criteria that are available for assessing whether a youth is a mature minor, and if they meet the criteria for being a mature minor, they may be vaccinated.
Our next question comes from Mara Gruel. Mara, please go ahead.
So hi, I'm Mayher Graywell from Worth a Shot, and I have two questions. So I'm getting my vaccine, but many other kids my age are either hesitant and not going to get it, or just wanting to wait to see what happens to other kids. So what would you say to them, and why is it so important for kids in the 12 to 15 age group to get vaccinated?
Sure. Thanks, Mara. And thanks for all your work getting vaccine out to the community. I know that they're very much appreciative, and so are we. So, it's really reasonable for people to question any, health treatment, medication that they may need. People should think hard about their health, their healthcare choices, the medications they take, the vaccinations they get. That's appropriate. And for youth who want to get vaccinated because they have seen what COVID can do, they know it can be serious, or they don't want to spread the disease to their family members or others in their community, or they just don't want to be part of an outbreak on their sports team or in their social group. That's awesome. It's the vaccine's available, it's safe, it's effective, and you should go for it. For those who are on the fence, that's understandable. And we want to help provide information to you, answer your questions, connect people to others who can help answer questions. Particularly, I suggest talking to folks who've been vaccinated about their experience, because most people will do fine. It's not uncommon for some to feel fever for a day or two afterwards, or feel fatigued, tired for a day or two afterwards. But it's a heck of a lot better than getting COVID-19. So for people who are on the fence, that's fine. They should take their time. They need to be comfortable with their decisions, but there's plenty of information out there. We have information on our website. There's information on the CDC website. There's great organizations like Worth a Shot that can help facilitate getting you information. And if you can't get your questions answered, you can email us at Public Health, and we'll try and connect you with someone who can answer your question, or answer your question ourselves. But, I say to these people, we understand why you might be hesitant. It's new, it's different. And, childhood vaccinations have been a great success story in the US in eliminating diseases that killed and sickened so many children over the years, ranging from measles to meningococcal disease, meningitis, to pneumococcal disease and pneumonia, and Haemophilus influenza B disease, hepatitis B, and HPV, preventing cancer, a cancer-preventing vaccine. In general, vaccines make us healthier, and we believe this vaccine in particular, during this public health emergency of COVID-19, will provide tremendous health benefits to individuals and to your community, to your family, to your friends. So we look forward to helping answer questions and understand, why some might want to take a little longer to, not everybody is an early adopter, but we hope you can, get your questions answered. And the sooner you get vaccinated, the more risk of getting COVID-19 and the potential for a serious complication yourself, or being unwittingly transmitting to someone else who gets a serious complication, the sooner that will happen.
Thanks, Dr. Duchin. And my second question is that there's been a lot of talk, especially on Twitter, that the sample size in the Pfizer trial was small. So what is your opinion on that? And should parents be concerned? And if not, why should parents not be concerned?
Yeah, well, I mean, the proceedings of the meeting today, where this was discussed, are available online. All the meeting materials at the ACIP website are available online. The sample sizes were relatively small in the 12 to 15-year-old age range, but don't forget, we have a huge sample size in the 16-year-old and plus age range. And, physiologically, 12 to 15-year-olds are not, that much different than 16 to, 16-year-old plus. These vaccines have been both studied in the clinical trials and in post-marketing now, and have had a very remarkable safety profile with great a great protection against disease and minimal adverse effect profile, relatively speaking. So, we're not expecting, and there's not a really biological basis to think that things will be much different in the 12 to 15-year-old age range. At the same time, safety monitoring will happen ongoing in real time. I mentioned Vsafe. I mean, that is a way to track how people are doing as they get their shots, in addition to those that were in the safety, the clinical trials, which didn't reveal any worrisome or unexpected side effects, similar to the clinical trials that were done with tens of thousands of older adults. But we will continue to monitor closely, and Vsafe is one way you can help us do that if you elect to be vaccinated. But it's the same vaccine, it's the same formulation, and 12 to 15-year-olds, are showing the same or better immune reaction to the vaccine, and at least as far as we can tell, and as far as people can predict, the safety profile is comparable to what it's been in the 16-year-old and up population.
Thank you so much, Dr. Duchin.
You're welcome.
Our next question comes from Evan Bush. Evan, please go ahead.
Thanks so much. Well, the previous questioner stole my question with some very smart, thoughtful questions. So, but I will follow up. Is the side effect profile any different in this 12 to 15-year-old age range as compared to older folks? And then, do you have any thoughts about how providers and parents should manage side effects with children? I'm sure they'll be interested to know a little bit more about that.
Mm-hmm. Yeah. Okay, Evan. So thank you. The main side effects in this group are similar to what we're seeing in the older children, 16-year-old up, and in adults. Primarily fatigue. And again, the numbers were not that different from the placebo group in some cases, but mild to moderate fatigue, mild to moderate fever, in 10 to 15%, some headaches, some chills lasting a day or two, and then a small fraction also would get some muscle aches. And these types of things are seen after a number of our vaccines. So basically, the side effect profile is similar to what you would see with other, routinely available vaccines. Maybe, we'll know over time, maybe a little more fatigue and fever and headache than you would see with things like influenza, but certainly nothing that was, worrisome or seemed to be, unusual. Compared to other vaccines, to placebo, or to the older children. In these side effects usually start on the second day after the second dose, usually, and last for two to 3 days. For some people, shorter, and many people, don't develop any of these symptoms at all. So I would, there's a lot of experience, using the mRNA vaccines in people 16 and older now. We haven't seen any unexpected serious side effects. And in this younger group, the side effect profile is similar to what it was in the older children and young adults and older adults as well. You can manage side effects, with Tylenol or nonsteroidals after the vaccine is administered, if you think that makes sense, from your child's perspective. And if you have any questions, you can connect with your healthcare provider about that. But there's nothing special that, is recommended, and it's not recommended to take those drugs before vaccination, only after, if necessary.
Thanks a lot. And Jessamine, did you have a follow-up question? Or is that a ghost hand?
I'm allowed to, okay. I didn't know if I could get unmuted. No, I think I just had my hand up still. But just to follow up on the Lumen Field event, you said that I'm just clarifying that it was completely okay for them to start vaccinating as soon as the announcement came down today.
Yeah, it would actually was legal and authorized for anyone to use the vaccine once the FDA authorized it, for this age group. But traditionally, in the U.S., before vaccines are used, folks wait, and it's recommended to wait for the Advisory Committee on Immunization Practices, the ACIP guidance. But in this case, there was no new guidance provided, so it didn't, would have no substantive effect on how the vaccine was administered, by the provider. So yes, it is perfectly fine to be administering it.
Thank you so much.
You're welcome.
And apologies, there's a couple folks with hands still up. Do you have follow-up questions, Steve McCarron?
Yeah, I just had a follow-up to Jessamyn's question, actually. I guess it was many people's understanding that you had the ACIP group that needed to sign off, and then also the Western States group that is meeting this evening, I think, to make a recommendation to the 4 states governors. So that isn't necessarily a requirement before shots can start going into arms, technically.
Well, it's not a federal requirement. You'd have to talk with the state about whether they are, requiring that of Washington state healthcare providers.
Thank you.
And just one additional question that came up in the chat, and it is, this is from Allison Grande. What impact do you see the vaccination of 12 to 15-year-olds having on summer activities such as summer camps, etc.?
I would anticipate it would make people a whole lot happier going to summer camp if they knew they were protected against COVID-19 and as many people as possible in their camp environment were protected against COVID-19, both campers and camp staff. So it has the potential to make people feel a lot more comfortable sending their kids to camp and to school, by the way, knowing that, kids will be less likely to acquire COVID-19 at camp or at school, and less likely to bring it home to someone who may be vulnerable or who can't be vaccinated because they've got an underlying medical condition, a transplant, chronic disease that they take steroids for, or some other reason. Every person that gets vaccinated contributes to community immunity, decreasing the level of risk that we all face, and getting us back to normal life sooner. And that it means childhood activities as well as adult activities.
That concludes our Q&A. Dr. Duchin, did you have any closing thoughts?
Well, again, thanks, folks, for being flexible today. We thought because of the ACIP meeting, it would be timely to just, have our session on Wednesday instead of Friday. If anything, new and noteworthy comes up, we'll certainly let folks know by Friday afternoon. But I'm gratified to see that it looks like, we're turning the corner on this latest surge of COVID-19 cases, hospitalizations in the county, hopefully in the state, and that as more people become vaccinated, we will put the potential for future surges further and further behind us, and the risk will be lower as we go forward, as long as we continue to vaccinate and understand that there still remains a risk as long as COVID-19 is circulating among people who are unvaccinated, that some precautions at this time are still in order, but as more people are vaccinated, fewer precautions will be needed, and they will be based on people's individual assessment of their personal risk and risk tolerance. So look forward to talking more with you about that over time, and thanks again for joining us.